Hello, and welcome to the introductory session for the Living Well class series. We call this Session 0. My name is Sharon Waldern, and I took the certification to lead these classes back in 2017, and I have a partner with me.
Hi, my name is Karina Herrera. I'm the Senior Service Coordinator, and I also took these classes in 2017.
All right. So we offer 3 separate weekly class series in this group of classes. There is Living Well with Chronic Conditions, and Living Well with Diabetes, and Living Well with Chronic Pain. And we will be going to a PowerPoint presentation for you to see the different things that we're talking about. So there we go. We talk about a variety of tools during these classes that can help us to live fully, independently, and positively for as long as possible, regardless of the condition that we've been diagnosed with. We believe in these programs, and all of our leaders, including Karina and myself, have become certified facilitators. These programs are evidence-based and were created by researchers at Stanford University in California. Each class series runs for 6 weeks, 1 day each week, and each of the sessions lasts 2 to 2.5 hours in length. Guidelines for class expectations are discussed at the first session and reviewed weekly. Today's session is just going to give you a brief overview of some of the tools that you will gain by attending one or all of the class series. I'm glad. We use the tools to help us complete self-management tasks. As you can see on the PowerPoint, our self-management tasks are to take care of our health condition, still be able to carry out our normal activities, and manage the emotional changes that often come with a chronic condition or another diagnosis. These workshops are designed to help us practice and perfect these tools that so that we can, and some of the things that we do as well is we share what we've already learned from our personal experiences. How come it's not advancing? There we go. These workshops are very interactive, far more so than today's is. And along with learning the tools, we get to share our own personal experiences. We're going to practice a few of the tools during today's session. A key component, so these are the guidelines that we go through at each class, and it's coming to every session. Number 2, being respectful of others and their ideas. We share things very freely. Maintaining confidentiality. Often as the class progresses, people share a lot of information about themselves and what they're going through. So we need to maintain the confidentiality of the things that we hear and not share it beyond the class. We talk a lot about new activities and trying things, and one of the things we ask is that any new activity is given at least a 2-week trial so that you can determine if it's really going to work for you or not. A 1 or 2 day trial usually isn't enough to develop a new tool. Make and complete a weekly action plan, and everyone turns off their cell phones and pagers. So, a key component to managing any condition that we are diagnosed with is identifying the symptom cycle. And as you can see on the slide, the symptom cycle is a cycle for a reason, because each of these symptoms can be caused by our chronic condition, but in reality, they also contribute to one another, and they can make our condition worse. So poor sleep can result in increased fatigue. Increased fatigue can result in poor sleep. Poor sleep also results in physical limitations. The more you decrease your physical activity, it often increases pain. Increased pain can cause stress and anxiety. Difficult emotions can cause stress and anxiety. Stress and anxiety can cause difficult emotions. Depression can come from difficult emotions, and difficult emotions can lead to depression. This is why it's a circle, because it goes backwards and forwards. There's no single direction for this. So throughout the workshops, we're going to learn to use several techniques that can impact how we think. The tool we're going to talk about today is called Using Your Mind. Go back to the toolkit. So Using Your Mind is on the right-hand side of the toolkit and on the second row down. So our minds are incredibly powerful tools. To demonstrate how our minds can affect our bodies, we're going to do a short activity. Get yourself comfortable as possible. Hope you're in a nice chair. You can even lay on the floor if you're at home, whatever you need to do to make yourself comfortable, and close your eyes. Now, imagine you're holding a big, bright yellow slice of lemon. Picture it in your mind. You can feel the texture of the lemon rind in your hand. Now lift the lemon to your nose. You can smell its strong citrus aroma. Next, bring the lemon slice to your mouth and take a big bite out of the lemon. It's juicy. The juice squirts all the way through your mouth. You can taste that tart lemon juice just filling your mouth. The juice dribbles down your chin. Suck the juice right out of that lemon. Open your eyes now. Think about what happened to your body while you were imagining the lemon juice in your mouth. Often when we read this to people, they were salivating. They felt puckering or tightness in the back of their jaw and along the side of their neck. All of these sensations that we get when we actually suck on a lemon, but there was no lemon there. This is our mind telling us and replicating an experience that's not physically happening. So it's really amazing what our minds can do. And this is just one example of how our mind can affect our body with very little effort. Just think about what we could do if we learned ways to use that power to help us cope with our symptoms. During the classes, we learn several different techniques. Some of these are distraction, relaxation, a body scan, positive thinking, stress, and guided imagery, to name a few. In addition, we talk about understanding emotions, which is a completely separate mind tool. And you can see that that's also here on the toolbox on the left-hand side at the bottom. So another tool we often refer to in all three series is physical activities, and that's right at the top on the left-hand side. There are three types of physical activities and goals that we talk about in these classes. Now you can go forward again. There we go. So flexibility is one type of activity. It's stretching and loosening our muscles and joints. This helps improve our balance, our coordination, and prepares our bodies for other exercises and activities such as gardening, shopping, cleaning, walking. The goal is to get to 10 minutes without stopping. You're going to do these stretches slowly, holding each of them for a few seconds and breathing in and out to relax as you stretch. These can be done daily and as a warm-up for more vigorous activities. The second one is strengthening activities. These make our muscles stronger by working them harder. Usually these are done with weights or against resistance. And oftentimes we can use our own body as a counterweight. This also helps, these exercises also help with balance and coordination. The goal for this group of exercises is doing them 8 to 10 repetitions, 2 to 3 days a week. Choose 8 to 10 exercises and start with no more than 5 repetitions of each of them, and then slowly increase over a 2-week period until you are at 10 repetitions. Strengthening exercises should also be done should be done every other day, not every day, because you want to give the muscles and joints time to adapt and strengthen, and yet not overwork them. 3 are endurance or aerobic activities. These are also called cardiovascular exercises. These include walking, swimming, biking, dancing, and they work most of the body and help increase our heart rate. The goal for this activity is moderate aerobic activities for 30 to 40 minutes at a time, 3 to 5 days a week. When you're exercising at a moderate level, you should be able to talk comfortably while you're doing the activity. You're going to work up to 150 minutes of aerobic activity every week. And again, it's not the whole 150 minutes isn't done at one time. You can spread it out. If you do it 5 days a week, you do it for 30 minutes, or you can do it 4 days a week for 40 minutes. Whatever works best for your schedule. There are as many different activities and exercise programs as there are people. And a program, you can start out with as little as 1 minute of activity each hour that you're awake, and then increase that to an hour a day, 5 days a week. The key is to start at your own pace and work towards your goal by increasing activity as you tolerate it. And these are some of the precautions that we go through in each class. Everyone has their own range of motion. The stretching exercises are going to slowly increase your range of motion, but you need to start where you're at. You also need to make sure with your provider that neck, back, and other exercises are okay for you. Sometimes people have conditions that they need to be more cautious with those exercises, and so you need to make sure that your doctor's okay with that. If you have been told that there are moves you should not do, do not do them, regardless of what kind of class you're in. We're adults, we can decide what we're able to do and not to do, and there's no point in pushing our body to do something that's going to harm us. And then one of the key things too is, especially as we get older or have problems with our back and legs, our muscles get a little weaker. And so when you get up, you need to make sure that you're not rocking backwards and then coming up. You want to tighten up those thigh muscles and move from sitting to standing in one smooth motion. During living well with chronic pain, there is a program that we introduce, and it's called the Moving Easy program. And it's a great way to start for those of us who haven't exercised for a while. It's a series of very gentle exercises that can be done daily. Starts mostly with sitting, and then you gradually work into some standing activities. With moderate endurance activity, these are the things you're going to feel: a slightly faster heart rate. So it shouldn't be beating out of your chest, but it should definitely have increased. You're going to be breathing faster and more deeply, and you should feel warm from the exercise. The other thing, though, is you should be able to continue for at least 10 minutes without any of these, without your heart rate, breathing, or temperature increasing anymore. You should be able to actually talk or recite a poem while you're exercising. And the other key is that after you have stopped, you should be fully recovered after 30 minutes. If it's taking more than that for you to recuperate from your exercise session, you're going to need to adapt it the next time, and either less repetitions, walk a little slower, but whatever it is that helps you stay within the range of moderate activity. Okay, healthy eating and weight management are actually two separate tools that we can also use to manage our conditions, but they are often linked in people's minds. We're going to talk about healthy eating during this introductory session. Healthy eating does not mean that we have to give up foods that we like or that we have to buy special foods. It's about learning to make healthier food choices. And in our workshops, we focus on beginning by making small, gradual changes in the way we eat or what we are eating. And over time, we can successfully change our habits. A key technique that we use to assist with this is the plate method that some of us who are a little older will remember the food pyramid that the USDA developed to explain healthy eating. But that has gone by the boards, and we are now using the plate method. And on this slide, it shows you the plate. It is based on a 9-inch plate. Now, for those of you at home, I want you to look at your plates. I want you to take down a salad plate, what we call a salad plate, or the middle-sized plate, and I want you to take down your dinner plate. You're going to find that the 9-inch plate is the salad plate, that middle plate. We all use the big size, but we need to go down to that smaller size. On one side of the plate, we have more vegetables than fruit, so the plate's divided in half, as you can see, but you've got more vegetables than fruit on the one side, and then on the other, you have more grains than protein. During this class, you're going to be provided with a book, and it has a great section on portion sizes, calorie counts, and the healthiest choices of each food type. So I'm not going to go into a lot of that detail today because we'll go through a lot more. It's just a nice visual to have, though. In the Living Well with Chronic Pain class, we actually go into a little bit more detail on foods that are known to impact chronic pain specifically. It's not a big chapter, but it's got some really good hints in there. Making changes like this can be difficult, and we have a better chance of making these changes permanent by tackling one or two things at a time, not everything all at once. And another technique with healthy eating is eating a variety of foods. Don't get stuck in a rut eating the same thing day in and day out. It's a little hard to stick to that kind of a food choice. Eating our meals and snacks regularly. Some people feel that if they, and I have to confess I'm not a big breakfast eater. What I've learned to do is I have like a shake in the morning. It doesn't fill me, it actually lasts a long time, but sipping at it is easier for me than sitting down and eating a breakfast. And then watching our portion sizes. And again, that goes back to that plate size that I was talking about earlier. You want to use that smaller plate size because it really does help you keep your portions smaller. Using a smaller plate doesn't mean you heap it up so everything's falling off of it. You very comfortably portion the food on there so it looks nice on there and doesn't overwhelm the plate. So that's another step for healthy eating. And a tool, for some of us though, these problems can feel insurmountable, or these changes can feel insurmountable. So another tool that we use is problem solving when we need to make a change. And what we do is we identify the problem. And that's actually the most difficult, important step. For example, someone might feel that they can't exercise because they're using a walker. The real problem may actually be that they're afraid that they'll fall down if they exercise. So you need to identify what really is the issue. And if it's falling down, there are things you can do to prevent that. And I've taught classes where people use their walker in the class and they exercise. List some ideas for solving the problem. For example, for the person with the walker, Find exercise alternatives for improving your balance or that can be done sitting down. Things like chair yoga, the Moving Easy program that I spoke about earlier. You can do Tai Chi, which is another nice, slow, gentle exercise program that really works your muscles. And then matter of balance classes as well. Then you want to decide which method you're going to use. So you select one of those classes. The next thing you're going to do is assess the results. Did this exercise option work for you? Was it comfortable? Was it easy for you to do? Did it work well for you? And if not, then go back to your idea list and pick another one. So substitute the new idea, continue to try and reassess until you find something that works well for you. And again, this is where that 2 week, if you're giving something new a try it for at least 2 weeks. It's going to take your body that long to get used to an exercise program if you haven't been exercising. It also takes that long for a new tool to start becoming a habit. So give it that 2 week try. If you've run out of ideas on your own, make another list and ask friends or family or your care provider or an exercise coach if they have any other ideas, and then again go through steps 3, 4, and 5. Sometimes the problem may not be solvable at this moment, and that's when you have to accept that the problem can't be solved right now, and you put it aside and revisit again at another time. Okay. A huge tool that we use and talk about a lot is communication skills. Communication skills are important in all kinds of relationships and are especially needed when we're managing chronic health problems or conditions. We need to obtain information about our condition. We need to keep others informed about our health and let them know how they can help us. We've all experienced communication problems at one time or another, when we're either not clear about what we want or need, or the people around us don't understand us and therefore don't know how to help us. Sometimes it's simply that the topic we need to talk about is really difficult to discuss. A lot of people who suffer from chronic pain do not like talking about it with other people. They're kind of the stoic, I'm going to just suck it up and we'll just move forward, when if they actually talk to other people about things that could help them and accept that help, it sometimes makes it easier. But during these classes, we offer a variety of suggestions to improve our communication skills. So number one, these are the kind of the key steps to several of the different communication skills. Identify what's really bothering us. This may not be easy, and it may take some really hard, honest thinking. And expressing our feelings. Express them constructively, using I messages versus you messages. An example is, I feel I'm not being heard versus you never listen to me. Another thing is when this happens, I feel sad. So like if you don't ask me out for dinner, I feel sad. Sometimes our friends avoid asking us out because they know that it's a real effort for us to get out of the house, but that starts making us feel a little isolated and neglected. So if we let our friends know, when you don't invite me for lunch, I do feel sad, or I feel left out. Those kinds of things, making sure you comfortably identify it and relate it. Listen attentively. Sometimes we are so anxious to respond that we don't really hear what others are saying to us. Try waiting a few seconds after the other person has spoken before you respond. Really hear what they're saying to you. Good listening is a key part of good communication. And I know we've all been in those conversations where you hear people all talking over top of one another. That is the epitome of not listening attentively. So Just to give you example in case you're wondering about that. Clarify. Repeat what you think you heard the other person say using your own words. Ask if it's accurate. An example we have is something about discussing advance directives bothers you. Can you tell me what that is? Or if somebody makes a comment to you that says, they say, I hate going out to dinner. What you can do is say, it sounds like you don't like going out to dinner. Can you describe to me more what that means? Or what is it about going out to dinner that you don't like? Those are ways to kind of get that conversation going. These techniques are useful to improve communications with partners, with friends, co-workers, and our healthcare professionals. When we're speaking with our healthcare providers, we need to be a bit more prepared and do our part to be prepared for our appointments. There is a little saying we have, and it's called taking part. And this is how, if you follow this tool, you can communicate more effectively with your provider. So we prepare. So how we prepare is we keep track of our symptoms. Are they changing? Are they getting worse? How is that impacting us? What is the effect that is having on us? Report that information, and then any medication or treatment changes since you last went. Have you reduced the dosage of your medication? Have you found that you're needing to take more of a medication to relieve symptoms? Did you stop a treatment that was being prescribed because it was too uncomfortable or for another reason? The other thing we need to do to be prepared is list our main concerns or questions that we want to talk about at the appointment. If we have a list with more than 2 or 3 topics on it, the best idea is to give the whole list to the provider because they can review it quickly, and sometimes we may not think it's an important issue, but the provider may see that it's got a big medical impact on us. So, and it also gives them, they can keep that list for the next appointment. A is ask. Ask questions about our diagnosis, the tests that are being ordered or the test results that have come back, the medications that we're on and why we're on them, the treatments that are being recommended and why they're being recommended, and then any plans for follow-up. R is for repeat. We need to repeat back to the provider in our own words the key points that were discussed during the visit to make sure that we both have the same understanding of the diagnosis, the next steps, the treatment plan. It's a very good idea to actually take notes or bring someone else with you to the appointment that can sit there and take notes for you so you can focus on what the doctor's saying. That person can focus on getting the notes written down of what the doctor's saying and planning. A lot of us come out of our doctor's appointments and we remember several things, but we don't remember everything. And I don't care how old we are or what conditions we have, that's a pretty typical response for everybody. And T is taking action. If you know there are barriers to being able to follow what the providers recommended, ask for written instructions to make sure we know exactly what it is that we're supposed to do at home and when the next appointments are scheduled. If there's a medication that's being prescribed, for example, and you know you can't afford it, you need to let your provider know that and ask if there's less expensive alternatives. That's just one example. If there's, sometimes they'll order physical therapy and you live in an area where it's really hard for you to get to those appointments, talk to the doctor about that as well. Okay, so these are the things that also help manage your health condition. What are your goals for the next 3 to 6 months? You know, look at where do I want to be 3 months from now? Do I want to be pain-free? Do I want to be able to go out and garden this summer without getting short of breath? Do I want to lose 10 pounds in the next 3 to 6 months. And then think about what are some of the steps you can take to help reach those goals. And then how sure are you that you can accomplish these goals on a scale from 0 to 10? 0 is you're looking at, you've set this goal, and then you say to yourself, there's no way I'm gonna achieve this goal. And then 10 is I've got this made, I'm gonna be able to do this in like 1 to 2 months. So you wanna make sure that you feel like you can accomplish this goal. There's nothing worse than setting a goal and then realizing after you set it that there really is no way of you reaching that goal. That is just a recipe for disappointment. So really look at what you want to do. And the other thing is, when you're setting goals for something like this, they should be your goals. Shouldn't be your primary care provider's goals, shouldn't be your husband's goal, shouldn't be your wife's goal, shouldn't be your best friend's goal or your daughter's or son's goal. It should be your goal. Now, they're all going to give you some advice, and you may want to listen to that and figure out, is there something else I'd like to do? But the goal is yours. Okay, so now after talking about goals, we're going to talk about making an action plan. This is something, regardless of which class you attend, you will do at the end of every single session. This is one of the key tools that we use in Living Well. And the reason being is sometimes it can be really overwhelming to think about all the changes that we want to make or the activities we want to accomplish. I'm thinking particularly when you walk out of the doctor's office and they've given you a new medication and they've told you they'd like you to lose 10 pounds before the next appointment, and they think you need to start walking more and et cetera, and stop smoking. All things that are good to do, but you're sitting there going, how the heck am I supposed to do all of these things? They can often seem too big to work on, which makes it really hard to get started because you feel defeated before you even begin. So this is where action planning comes in. It allows us to achieve the changes we want by breaking them down by breaking down the activity into smaller, more doable steps. So, for example, we want to improve our fitness level by breaking this big goal into one of these smaller goals to start off with, and this is just an example. So I want to improve my fitness. So I've got a choice of researching what types of exercises would be the best to do. Or I can look for facilities that are available to exercise at near me, like a local pool, an exercise club, senior center, churches, what walking paths are around. Another thing I can do is start by walking for 5 minutes, 2 to 3 days a week. A fourth choice is reading about exercises in the Living a Healthy Life book, which is provided during the class. They have a wonderful chapter on physical activities. Number 5 is finding a friend who's willing to exercise with you for at least 2 to 3 days a week. So that is not the whole plan. You pick one of those steps, and that is your plan for the next week. So the key to the action plan is that we don't have to do all the steps at once, but we need to get started by deciding which step we're going to work on for this week, and exactly how we're going to do it. So an action plan is something that you want to do. Again, it's just like those goals I was talking about. Sometimes people will have input on the goals, but with an action plan, it is something you want to do. It is something that you know you can achieve. It's very action specific, and when you write out the plan, it answers the questions: what am I going to do? How much am I going to do? When am I going to do this? And how often am I going to do this? And then your confidence level needs to be 7 or above. Anything below a 7 is a good indication that it's going to be difficult for you to achieve. So we need to revamp that action plan so that you know you can achieve it. So an example is Some people put down, I'm going to lose weight. Now, that's not an action or a behavior. It's not very specific. What we can do instead is, I'm going to replace my afternoon snack of chips with a piece of fruit or veggies and hummus. We're going to lose weight as a result of that action, but losing weight is not an action. It's not specific enough. So that's what we're going to do. That's our specific action. I'm going to do that in the afternoon. So that's when I'm doing it, in the afternoon. How much? I'm going to limit it to half an apple or an orange or a pear. So I'm going to be real specific about my amount, or it's going to be 10 carrot slices with 2 tablespoons of hummus. And then how often? I'm going to do that 4 days a week. So my confidence level, if I were doing this myself right now, would be definitely be a 9. That is something I can do. Some people, it might not be as effective. I have worked with several people that have, and they've admitted it. They've got a really bad candy habit. So what their action plan was very specifically is they went through their house and gathered up all the bags of chips and candy and stuff. And they did it the very first day, and they got rid of it all. And then they went out and bought groceries so that they could do their healthy snacks and not be tempted. So there's different ways of doing these action plans. But that is a key part of this class. I'm hoping that you've gotten information that you appreciate. I've got another action of an example of an action plan. This was one where it was, I'll find out what types of exercise class options are available in my area by looking on the internet, talking with my provider or physical therapist, and checking at my local senior center. And I'll do this in the afternoons for 30 minutes on Monday, Wednesday, and Thursday. And my confidence level is a 9 that I will be able to get this plan completed. So that is for 1 week. The next week, you might then go and decide to visit each of the facilities that you found and decide which one was going to work for you. So as you can see, you take one small step and you move on. So if you like this class, these workshops build upon the information that was presented today, and it's living well with chronic conditions, living well with diabetes, living well with chronic pain. And you can call the Good Shepherd Education Department at 541-667-3509 for more information and to enroll or find out when we're going to be starting these classes in the future.